The Supreme Court will hear a case on April 2nd that could effectively take away patients' right to choose their healthcare provider. And while they hear the case, we'll be outside the Supreme Court and let them know Americans don't want politicians to force their beliefs on everyone. The case is Medina versus Planned Parenthood South Atlantic, and the court could decide if Medicaid patients can sue when their state blocks them from getting sexual and reproductive health care at the provider that they want, including at Planned Parenthood health centers. The government has no business in our healthcare decisions. How did we even get here? So, let me catch you up. Back in 2018, South Carolina and anti-abortion governor Henry McMaster issued a state executive order that blocked Medicaid patients from getting healthcare services at Planned Parenthood South Atlantic Health Centers, aka PPSAT. Yes, let me run that back. A U.S. governor tried to end patient access to essential care, meaning cancer screenings, birth control, and other affordable Planned Parenthood Health Center services based off of his personal beliefs. Get this. Federal law says that people with Medicaid have the right to pick their own qualified health care provider, including for family planning services. So, PP sat and a patient sued and won in federal court. A lower court ruled twice that Medicaid patients can sue to get care from Planned Parenthood health centers, and then an appeals court backed up that finding 3 times. So, if the Supreme Court rules against PPSAT, other states could follow the same route and block millions of people across the country from vital and affordable healthcare at their trusted provider. So now, 64% of Planned Parenthood's nearly 600 healthcare centers are located in rural and medically underserved areas, and they're among the few providers that accept Medicaid. More than half of Planned Parenthood patients struggle to make ends meet, and they simply have nowhere else to turn for care. People's health and lives are at stake right now. We cannot sit back while out-of-touch lawmakers take away care from people who need it most, and we cannot afford to let them make the public health care crisis they caused even worse. So, join us April 2nd to rally in front of the Supreme Court to show that patients matter. Care at Planned Parenthood health centers matter, and everyone deserves to get the sexual and reproductive health care that they need, no matter your income, no matter your zip code, no matter your insurance status. Make your voice heard and RSVP at the link in our profile.